COVID, we were shut down the beginning of the year in March. We were unable to see patients, and this kind of gave us a window of opportunity to be able to at least let our patients know that we were still here.
We were scrambling to figure out what services we could provide to our patients while also balancing the risk to our staff members. We also, of course, wanted to keep people out of the hospital, as we always do, but especially during COVID, when our hospital in our county was and still is seeing COVID patients.
Some patients did have true emergencies, so we were able to kind of see if they had any facial swelling. They could send us a picture of their tooth. They could point to it. We could see them live, so that was great. If that was the case, we would, call in an antibiotic, set them a time in clinic, make sure the clinic was set up to bring somebody in, ask them the COVID questions so everybody was safe. If the patient had a non-emergency like gingivitis that was bothering them, then we use that time to give them oral hygiene instructions, dental education, in which they would have not gotten if we didn't have the platform.
It's been a blessing for the organization as a whole. We've been able to provide a service to many patients, and basically it was a gateway to their living room.
We could see our patients in person, kind of face to face, to see exactly what was going on.
We're trying to limit as many people in the operatory as possible, so we have it as an interpretation service with an interpreter that we use here, and so she's able to work from home.
It just helped me have a better idea of what I need to do for my patients and how much I need to prepare.
So once you're talking to them face to face, it's a little bit more personal, and they can kind of, become personal with you and share more so that you can help treat them in the best way possible.
It makes a difference when you can see someone on the screen versus talking to them on the phone. You could pinpoint their chief complaint better, and your message, whether it's just dental education, oral hygiene instructions, or really seeing how intense the swelling is, you could see that instead of just talking to them on the phone.
I think the biggest aspect of teledentistry is that we are able to reach patients where they are at that time. As we all know, access to care is a big problem for our pediatric and our adult populations. I remember having conversations with someone who was taking a break at work to have their conversation and their triage so that they didn't have to come in multiple times. They were able to save gas money, save time off of work. And so I think teledentistry is an excellent tool for reducing the burden on our patients.
I think a lot of offices and different facilities can use this to reach more patients.
We're going to be using it, whether COVID is there or not.
Once they get in the chair, all you have to do is get them to sign a few things and you're ready to go, versus being like, okay, let's talk about this, let's talk about this. So it's more beneficial because they don't have to come in. They don't have to find a babysitter. They don't have to take time off work. They don't have to make sure that their day is free. You can just call them whenever they're available and talk to them then.
We actually just got off of a teledental call just a few minutes ago with a new patient that we'll be seeing for the first time next week. So it's been a good opportunity to introduce ourselves before they come in, so they know what to expect. It's just a one-on-one contact versus over the phone.